The first part of this class really builds upon some key ideas. We've already established the idea that health communication is the study of a context, where we apply other communication theories to specific health issues. We've also talked about health literacy as the ability to obtain, understand, and use health information to make informed health decisions. Unit 3 turns our attention to the topic of health needs. One of your readings for this unit, the Community Toolbox, defines health needs as the gap that exists between what is and what should be. And this is a really important idea when it comes to the study of health communication, because there's the ideal version of what we all want when it comes to being healthy. But as the Rolling Stones told us, you can't always get what you want, and so sometimes you have to focus on what you need. And that's what the study of health needs really addresses, is that gap that exists between that ideal version of what we all want and the reality of what it actually means to pursue a healthy life. So in this video, I'm going to take a few moments to talk a little bit about basic needs assessment, as well as two specific kinds of assessment, one called an environmental scan or an asset map, and the other called Photovoice. These three kinds of needs assessment, the basic, the environmental scan, and Photovoice, won't necessarily make you an expert when it comes to assessing health needs, but it will give you a good introduction to the different ways that you can find out from people what they actually need when it comes to being healthy. This information can be useful in a variety of contexts, from designing health campaigns to designing specific health messages for a group, or even just to talk to your family and friends about what it means to be healthy. First up, we have a basic needs assessment. And honestly, probably the best resource that I can give you in any class, let alone a health communication class, is the Community Toolbox. The Community Toolbox is an online resource that was established by the University of Kansas to give you a lot of resources when it comes to designing community-based activities, events, and campaigns. When you head over to the Community Toolbox webpage, you have a wide range of resources at your disposal. Probably the most important resource that they have is the Learn a Skill, and that's where they have their table of contents and their toolkits, which provide the core for the Community Toolbox approach. You can also get some additional resources in terms of taking action for your work, connecting with other people who might be doing similar work. You can find out some information about the toolboxes and some of the services that they provide. I do also want to turn your attention to the services that are down on the first page of the web page. When it comes to constructing a needs assessment, perhaps one of the best pieces of advice I can give you is don't reinvent the wheel. Look to see what other sorts of assessment tools and evaluation tools are already out there. And Community Toolbox provides you an example of what I'm talking about. With their services, they have different workstations, which are online platforms for collaborative action. They've got capacity building and participatory evaluation. So here's some technical support and different assessment tools that you can use to gather information when it comes to health needs. There are also some tracking and monitoring systems that they have set up. A great way that you as a communication person can make a contribution to a project is to help track and monitor the different types of communication and activities that are going on. And a site like this can provide you with the resources that you need. And then you can also go through their toolbox curriculum, and I'm going to focus on this here in just a second. But the major point that I'm trying to make is websites like these give you a leg up when it comes to making contributions to a communication project, specifically one that is geared toward community and health in this case. Back up at the top of the first page of the web page, I'm going to go ahead and click on Learn a Skill and go to the table of contents. Now, the table of contents on Community Toolbox is great because it gives you an overview of 46, that's right, 46 chapters that give you some step-by-step guidance on community building skills, and you can apply these to designing health promotion programs and health communication messages. So in the very beginning, they focus on things like an overview of their approach. They also give you some related toolkits to each chapter so that not only do you get the instruction, but you also get some specific tools and resources that you can apply in future projects. I'm going to go ahead and scan down to Chapter 3 because that's what I had you read for Unit 3. And Chapter 3 focuses on assessing community needs and resources. You'll notice that in Chapter 3, there are 23 sections of information. So in Community Toolbox, there's 46 chapters, and each chapter has multiple sections, in this case, at least 23. So Community Toolbox is giving you a lot of detailed information. It can kind of be overwhelming at some points in time. However, it's incredibly useful, and it's a great toolkit to keep in your back pocket anytime you are working on some sort of project that requires community interaction and communication. It also gives you a really great crash course in how to do research around assessing needs. Now, the creators of Community Toolbox were very smart because they have a lot of information. They organized it in a pretty logical and step-by-step manner. So if you look up at the top here, it starts off with developing a plan for assessing local needs. You always want to start with a plan so that you know where you're going. But then it follows kind of a logical progression in terms of understanding and describing your community, conducting public listening forums and sessions, collecting information about the problem. All of these are really good steps when it comes to assessing needs. I really want you to take the time to explore Chapter 3 and look at the different approaches and different strategies that they suggest. In terms of completing your assignments for Unit 3, you're really going to want to pay attention to things like conducting focus groups, conducting needs assessment surveys, and down here with sections 12 and 13 about conducting interviews and conducting surveys. I'm asking you to design some materials that can help you really start to grasp what it means to design a needs assessment. And those are some of the sections that are going to help you the most. And when it comes to performing a basic needs assessment, these are some of your biggest resources and biggest tools that you're going to use. A focus group, a needs assessment survey, an interview, or a regular survey. In the next video for this unit, I am going to walk through some of the specific details and tips for conducting focus groups, for creating an interview guide, for setting up a survey, so that you can make sure that, again, you might not be an expert when it comes to assessing needs after taking this class, but you at least have a basic idea of what it means to gather information from humans, from individuals and groups, about what it means to be healthy. So, Community Toolbox, I can't say enough good things about this resource. It's incredibly useful when it comes to health communication, but also a variety of different topics. I have used it in several different contexts when it comes to designing some of the programs that I've worked on when it comes to food. One final word on basic needs assessment. I do have a sample of a basic communication needs assessment on the Blackboard site for you. This is a needs assessment that was done at Advanced Home Care, which is a healthcare organization. And I think it's really important to think about what you are actually assessing when it comes to a basic needs assessment. Are you assessing communication needs, or are you assessing some sort of health needs? The sample survey that I gave you is really assessing communication needs. And there are a lot of other great examples out there of health needs assessment tools that actually focus on health. One example that I can share with you right now that you could take a look at is something called the National College Health Assessment. Go ahead and Google that, take a look at it. The National College Health Assessment focuses on gathering a lot of information from college students about specific health needs that they have during that kind of 18 to 24 year age range that most college students are in. A basic health needs assessment starts to focus on what it means to be healthy and what resources are out there to help you achieve the health that you desire. Another kind of health needs assessment is what we call an environmental scan or an asset map. And a lot of times, this kind of needs assessment will take the answers that you got from the what are the health resources that are out there question and start to map them out in a way so that you can find out where the gaps exist between the health wants and the health needs, between the ideal version and the version that we're actually working with. For example, I worked on a health campaign at Arizona State University where we focused on the topic of dangerous drinking. Our goal was not necessarily to encourage people to stop drinking or not to drink at all. Rather, it was to help educate people so that they didn't get alcohol poisoning and die. And one of the very first things that the project did was to map out all of the different resources as well as mapping out all of the bars and restaurants, all of the liquor stores and convenience stores that were close to campus, and mapping all of those out in a way that we could literally see how many steps would it take for an average freshman to get from the dorm to the health center? Or how many steps would it take for somebody who lives in a dorm to get to the closest bar or liquor store? And in doing so, it really gave us a big picture regarding what were the resources that were available to students, what were the gaps between that idealized version as well as what was real on the ground, and then how could we use this information in such a way to design a campaign to help students realize that there's a safe way to drink so that you can have a good time but not necessarily risk your life. Another example that I can give you, and it actually provides a map for you to look at, is the USDA's Food Access Research Atlas. And the Food Access Research Atlas is a way to map food deserts in the United States based off of your zip code. So I'm going to go ahead and click on the website link to the Research Atlas. And that gets me to this web page, which gives an overview of the Food Access Research Atlas. It tells you what you can do with it. You can create maps showing food access indicators by census tract. And again, it really focuses on giving you an environmental scan of the food deserts that are in your zip code, or the zip code that you're going to work with for your health campaign or your health project. I'm going to go ahead and go to the atlas. And as I suggested, it's a map. So you can take a look right now at all of the census tracts in the United States that are currently food deserts. And to count as a food desert, you both have to be low income and low access, meaning that a certain number of people who live in your census tract have to live below the poverty line. And a certain number of people also have to live more than a mile from a grocery store or supermarket in an urban area, or more than 10 miles in an urban area. So let's go ahead and type in 27403, which is the zip code closest to UNCG. And that will zoom us in on Greensboro right here at the University of North Carolina at Greensboro. I'm going to go ahead and zoom out just a little bit so you can see a bigger sense of all of the food deserts that are in Greensboro. Right now we know we have 17 food deserts total. And most of them, as you can see, are concentrated on the south side of town and on the northeast side of town. There are literally no grocery stores in this area. Most of the grocery stores in Greensboro are concentrated around the Friendly Center or up Battleground Avenue. There is a Walmart over here, and I think there's another Walmart over here that helps to provide some of the need in these two areas. However, you can also see that there are some significant needs for access to food here in the southern part of Greensboro as well as the northeastern part of Greensboro. When we were first able to map these different food deserts, it really gave us a clear sense of where the specific food needs were. But we were also able to couple that information with some of the statistics that came from our epidemiologist, Dr. Mark Smith, for the Guilford County Department of Public Health. And he also helped us to realize that many of these areas are concentrated where there are high rates of poverty, high rates of chronic health problems, and high rates of racial minorities. And so we realized that we really had some specific public health needs in these areas. Greensboro, as I've mentioned before, is one of the most food insecure metropolitan areas in the United States. And that in part is because of how we have our food distribution organized. Because we were able to create this asset map and this environmental scan, we were actually able to get a picture of where all of our grocery stores and supermarkets were. We were able to identify the gaps very specifically, and now we're working on designing projects to help fulfill some of those needs and fill in some of those gaps. The last type of health needs assessment that I would like to introduce you to is a really unique approach called Photovoice. Photovoice involves giving cameras to the community members and participants who we're trying to work with on our health campaigns and health promotion programs. So basically, it's a way to give a voice to people who don't always have a voice when it comes to articulating health needs within their communities. It goes right to that community and empowers them and gives them a way to really tell their own story when it comes to health and what it means to be healthy. Photovoice was started as a way to address specific literacy needs. Now, people don't always have the literacy skills needed to fill out a really complex survey. It might be very difficult for them to even sit down for an interview for an extended period of time. In many cases, Photovoice is geared towards some of our most in-need populations, so young children and the elderly. And in many cases, young children, and even in some cases the elderly, might not always have the capacity to share their stories through surveys and interviews and some of those traditional ways of assessing health needs. So what Photovoice does is that it gives participants cameras and asks them a question like, what does it mean to be healthy? Or what does hunger look like? Or how can we improve health in your community? Or what are some of the barriers that your community faces when it comes to being healthy? Again, a wide range of questions that you can ask, and then you set your participants loose with some cameras and let them take some pictures. The process culminates by developing the pictures for the participants and allowing them the opportunity to sit down and talk through what their pictures mean. So they also get to share the story behind the pictures. And in many cases, you develop a short caption that goes along with each picture in the Photovoice project. Now, if you're going to follow the needs assessment and the approach to its end, it actually calls for you to do an art exhibit with all of these photographs and invite local community leaders, city council members, county board members, members of the community, members of the target population, and really open it up to the public and give people an opportunity to share their stories in a much more public venue. The idea being that when a larger community sees these specific health needs in the photo exhibit, people are much more likely to act upon that because there's a very tangible and present sense to these pictures. I've included a link to the photovoice.org website on the PowerPoint slides, and I'll let you go ahead and poke around on the website a little bit and check out some of the projects that they're a part of. There are some really interesting stories. They have some competitions. They have training dates. They have ways that you can implement their approach in multiple different venues. And this is just one example of a Photovoice organization. Photovoice is really a much larger research methodology that helps people assess needs in marginalized communities. So again, this is just one example. And it's a really powerful example of how we can assess health needs using some less traditional methods. We don't always have to do just an interview or a survey or a focus group. There are ways that you can get some really meaningful stories and communication from people just by giving them a camera and letting them take some pictures. That's going to do it for this first video on health needs for Unit 3. Make sure you check out the next video, which helps give you some specific tips on how to construct interviews, surveys, focus groups, and other assessment tools for a basic needs assessment.